COVID restrictions, they're lifting here in Massachusetts and across the country, but there's new guidance and it could soon offer new insight into how that should happen.
And here to answer your questions right now is Dr. Simone Wiles. She's an infectious disease expert at South Shore Health. It's great to see you, Dr. Wiles. Thanks so much for your time. So I'm going to give you a lot of initials here, but CNN is reporting that the CDC could now offer new metrics about when and how to lift restrictions as early as tomorrow. So I'm going to ask you two questions. The first one is, what are we looking at? And the second one is, isn't the horse already out of the barn?
Ed, thank you for that question. The CDC has been responsible for managing all the cases of COVID-19 across the country. And I think right now, as we've seen the number of cases decreasing, the hospitalization decreasing, as well as deaths and the positivity rates, I think the CDC is ready to pivot and provide and give the local health department the opportunity to take care of the cases and manage things based on what's happening in their local county. I think that really is a huge sign for us, as we can see in Massachusetts and in other states. They've already been doing that. So I think, yes, things have started to move, but as we always say, all healthcare is local.
Yep.
Yes, we do say that. So, Doctor, nice to see you. Thank you for joining us. We always appreciate your insight. We are learning more, it seems, every day about this new variant, Omicron BA.2, including how well our defenses are holding up against that. So what are these new studies telling us, and is there cause for concern? Because so far, so good.
Maria, we have some good news. The studies, even though they're very small studies, they give us some reassurance that the BA.2 subvariant, even though it's more contagious, maybe about 30%, the good news is it does not cause as much hospitalizations and deaths. So I think that's really good for us to hear. And then the other thing that the studies have shown is that those who have been vaccinated and boosted and they end up with the Omicron infection, that they have very high immunity. And so what that means is the chances of you getting reinfected is very low. So I'm going to use this opportunity to tell those who have not yet been vaccinated or boosted that I think it's a good time for you to go ahead and do so.
Dr. Wiles, let's get to a couple of viewer questions, if you don't mind. And we hear this question a lot. Maureen asks, for those of us who received the J&J as the initial vaccine and then received the Pfizer Moderna booster, has the FDA, CDC determined if they should receive a third shot?
Maureen, thank you for that question, and it is very common, and I'm happy to know that you got your J&J and you got your messenger RNA booster vaccine. At this time, the CDC only recommends one COVID booster for those who have had the J&J vaccine. I will tell you that they're always looking and assessing this data, so right now, no additional information to add, but things might change.
Really quickly, Doctor, this one's from Michelle. If you test positive for COVID, should you take a rapid test after you are symptom-free, or are you going to still test positive for a period of time?
Michelle, thank you for that question. I will say that at this time, I would not recommend that you get another test for COVID, especially if you're if you're symptom-free, because the key thing is we've found that you can remain positive for up to 90 days. So unless you are having symptoms, no need to go ahead and get retested.
Hey, Dr. Wiles, if you don't mind my saying, because you shared with the viewers that you had it, you look wonderful, by the way. How are you feeling? You feeling well?
I am feeling well. Thank you so much.
Good. Great. Stay that way.
Okay.
Yeah, stay that way, indeed. And